Hi, it's Doug from the Wellness Dentistry Network. People ask me, how do you get into sleep medicine, or what's our sleep module for? And I know we call it sleep apnea, but now we're thinking about airway. And in our Wellness Dentistry Network, we have some great people, Steve Acker and Nancy Hartrick and Steve Lamberg, and we have Michael Gelb, and we have some really great people who have worked in sleep medicine. And this is an exploding area for us as part of our WDN and our patient awareness campaign. So one of the things we recommend that offices start to do is get to become really great at screening for issues, both anatomical issues, functional issues. And anatomical issues would be things like lip tie, tongue tie, narrow arches, things that restrict the airflow in some way. And the big question that we always used to ask is, do you snore? And if you have a patient that snores and trips that question, then we would give a series of questionnaires, and you can look in the library for those questionnaires, because it would be the Epworth, the Sleep Partner Survey, the Lamberg's questionnaire, and we would give these kind of questionnaires that would alert us that maybe the patient should complete a sleep study. Well, what if you have a patient who does a sleep study? And I think you should get involved in either a really simply home sleep study, and this is a watch pat study, or you could get involved in a high resolution pulse oximetry study, and you find out that a person has either very, very mild sleep apnea with a very low RDI, which is a respiratory disturbance index. What could you do for that patient? Well, sometimes you could simply do it by shifting their breathing from through their mouth to breathing through their nose at night. Breathing and having somebody from shifting their breathing simply from their mouth to their nose could eliminate snoring, could cut their AHI, their apnea-hypopnea index, in half, could do a lot of good things for them. We have supportive questionnaires, we have supportive educational materials in the library to help patients learn this. And I just got off the phone with a patient that has a very low apnea-hypopnea index, has a very relatively low RDI, but it's over 10, and this patient's not getting restful sleep. So we had a brief phone consultation. We're going to start with simple nasal breathing. We're going to start with some simple lip sealing. We'll retest and we'll see, and that might be all it takes. So you don't need to be into making mandibular advancement appliances. You don't need to be into doing sophisticated sleep medicine treatment plans. You need to be into screening, early identification, and doing some very simple things first to see if you can help, and then passing the baton to somebody more experienced if you're just getting involved. I hope that helps in your sleep medicine module. And again, we have a health measurables that matter informational about sleep apnea and about the significance of a restful night's sleep.